Right now, every family in this country has been hit by cancer.
Cancer kills more people in sub-Saharan Africa than HIV, tuberculosis, and malaria combined. In the United States, childhood cancers like Burkitt lymphoma or leukemia, these are associated with cure rates that are greater than 90%. Here in Uganda, less than 30% of the children may be alive 5 years after they're diagnosed. In 2004 was when we really began the collaboration between the Hutchinson Center and the Uganda Cancer Institute.
Uganda is one of the countries in Africa with highest incidences of mostly infection-related cancers.
We have only one cancer treatment center, which is the Uganda Cancer Institute.
A single oncologist here was seeing over 10,000 patients a year.
I could clearly see cancer is really something which is likely to become a big problem.
Clearly, with only one oncologist, the needs of cancer in the country can't be met. We initiated a training program with the Uganda Cancer Institute, and in the last 4 years, we've trained 11 new cancer doctors.
That foundation has really led to tremendous advances and changes at the UCI.
The Fred Hutchinson Cancer Research Center is so committed to working with us.
The Fred Hutchinson Cancer Research Center has had a very big hand in training our physicians.
All our clinicians, all our oncologists had an experience with the Fred Hutch.
There is a lot of sharing of ideas between our doctors here and their doctors there.
You can actually see all these opportunities that the Fred Hutch has been able to create for this institute.
Once you have interacted with somebody, that friendship becomes like a brotherhood. This is the kind of bond that is binding the Uganda Cancer Institute and the Fred Hutchinson Cancer Research Center.
We're looking for support for a holistic approach to cancer care. Not just the drugs, but the drugs, the team, the physician, the nurse, the pharmacist, and the infrastructure.
We receive so many patients on a daily basis, so many.
Infrastructure has two components. There's a physical infrastructure and a human capacity to do this work.
We end up having to admit a patient, but there are no beds.
The caretakers, of course, would sleep on the floor.
Someone either has to pass on for you to get in, or someone has to have finished their treatment.
We're building a new building. That facility will treat 20,000 patients a year. Within that building, we want to have state-of-the-art laboratories and state-of-the-art training facilities. And support for those facilities will make enormous differences in the short-term future.
The result that will emerge out of those is not only going to be for here, but it is going to be for the world over.
It's very important that the work we do is locally relevant, both in Seattle and in Uganda.
What really excites me about our work in Uganda is the potential to develop vaccines to eradicate 20% of cancers worldwide. We have the potential to eliminate cancers like lymphoma from Epstein-Barr virus, stomach cancer from Helicobacter pylori, bladder cancer from parasitic infections, and other cancers that are caused by infectious diseases.
When it comes to cancer research in Africa, we need to be the leaders.
A lot of the practices in the Western world were informed by something that was done here.
Research is our resource, but it was not in place until Fred Hutchinson Cancer Research Center came here.
We are beginning to now seek from our own initiative in our own minds what we consider to be important questions.
We've collected over 100,000 clinical specimens.
Look at the things that can be learnt in Uganda and brought back, but at the same time, you are helping out people who are less privileged.
The situation is promising, but the situation is still really in need of a lot of support.
When people donate money to this program, the difference it can make on the ground is great.
Even small donations make a difference. A child with Burkitt's can receive the full round of chemo they need for roughly $1,000 US.
While the burden is enormous and the suffering is enormous, the possibilities and the potential are also enormous. We right now have the tools to prevent or to treat better these cancers. This is not something that's 30 years in the future. There are opportunities, and those opportunities, I think, are within our reach, within our means, and can happen within our lifetime. The possibilities, I think, are really endless.